Hello, everyone. Uh, we are all going through a tough time now. Mm, the whole of India and most of the world is under lockdown to protect ourselves from the deadly COVID-19 virus. See, this COVID-19 virus is not as deadly as the Nipah virus that we had in Kerala uh, last 2 years back, uh, which had a very high mortality. But the issue with COVID-19 is that it's highly contagious. It spreads very fast from person to person, and it spreads through uh, the droplets. See, the signs and symptoms of this COVID-19 virus is fever, cough, sneezing. Uh, so these are the basic. Then they'll have breathlessness because it basically affects the lungs. So when they cough or sneeze, the droplets come out of their mouth, and either these droplets directly come and fall on either your face or your eyes, through which it spreads, or it can fall on any surface, like the table here, or even the currency that you're exchanging. So it stays there for some hours. Then after that, when you handle these surfaces which has these droplets on, then it gets onto your fingers. Then you touch your face, your mouth, or your eyes. You rub your eyes for some reason. The organism gets spread to us. So this is basically how the COVID-19 spreads, and it's basically for this reason that the basic preventive measure is social distancing. See, 1 meter or 2 meter gap between individuals, and it might not be very easy to enforce this social distancing, and that is the reason why the government has decided on lockdown. But the good thing now is that there is a sign in India and especially in Kerala that the spread of the virus has peaked and now it has plateaued. And that's the only reason why from yesterday a lot of relaxations have been made on the COVID-19 related restrictions. So, see why eye care is important in this COVID-19 situation is that, so I mean, as you all know, most probably you know that it was an ophthalmologist, it was an eye surgeon from Wuhan in China. So basically, you know that it started from Wuhan in China, and this doctor, Dr. Li Wenlei, he was an ophthalmologist in the hospital in Wuhan, who actually noticed that there is a fast-spreading virus which is taking away a lot of lives that is happening in their hospital. And it was through him that everyone got to know about it. See, the highly contagious nature of this virus is quite evident by the fact that this ophthalmologist died from COVID-19 infection, which he got from his glaucoma patient who had COVID-19. See, the problem with an ophthalmologist or ENT surgeon is that we are at a higher risk of getting it from the patients, because we go very close to the patient while examining. See, unlike you examine with a stethoscope and all, you have to go very close to the patient when we examine. If you have visited an eye surgeon, you would know that one of the basic instruments in which through which he or she examines you is a slit lamp, where you have to keep your chin on a chin rest, and he looks through a microscope. So when he does that, he or she does that, his face comes very close to your face, and there is a high risk of if you are a carrier, if you as a patient is a carrier of the COVID-19, giving it to the eye surgeon. And once the eye surgeon gets infected, he can be a source of infection to the other patients also. So previously, when you used to go to any eye hospital, you just walk in, register, go for a vision checkup, and then go to the doctor. There's absolutely no restriction, and the surgeon, you can see the surgeon's face and all, and those on the reception. But now that the relaxations are being have come into effect, you will be able to visit eye hospitals, but you will see a lot of changes there. So you will be asked history about any contact with the COVID-19 patient, any history of travel abroad, or even to other states also. See, yesterday in Kerala, there were only 6 new COVID patients. But you take Maharashtra, Delhi, and other states, there's a huge lot of number of new COVID patients. So, see, now that Kerala or any state, for that matter, was brought it under control, is never safe, because it's a continuum. See, it's a continuous world. So a person can come from an area where there is COVID, and he can give it to persons in area where COVID-19 is not there. So we have to keep the social distancing and cares for some more time. So as I said, you'll be asked history regarding COVID-19 contact. Then you'll have to wash your hands, or there'll be an area where you can wash your hands with soap and water. We'll be giving you hand rub to sterilize your hands, and there'll be a lot of previously when you used to sit in a eye hospital, you used to sit close to each other. Now what we have done in our hospital, and most of the hospitals, is that one seat the patient sits, the other seat is blocked. So there is a gap between patients. So you might feel that it's a bit too much and it's taking a lot of time, and you don't have the personal attention, because if a doctor, you can't see the doctor's face because he's wearing a mask, he's wearing gloves, and some cases he might even be wearing an apron. So this is all for your protection. You should understand that. So you have to be really careful with it. Then see how does COVID-19 directly affect the eyes? As I said, it can spread the droplets that has come from a COVID-19 patient can enter our body through our eyes also, in addition to mouth and nose and all. So that is one. So now the question comes, can it spread through tears? Studies have shown that it doesn't actually spread through tears. Then what are the signs that COVID-19 infection in an eye produce? See, studies have shown, because this is a very new infection, so not a lot of studies are there, but there are case reports which have shown that those COVID-19 patients who has severe chest infection and difficulty in breathing and all, quite a few of them have had redness of the eyes, what we call conjunctivitis. So do we consider any patient who comes with conjunctivitis during this time as having COVID-19? Not really. See, this summer season is a season when you get a lot of allergic conjunctivitis. So there's redness. Many cases is because of allergic conjunctivitis, or it could be infective conjunctivitis also. Because I've been seeing, we as of now are seeing only emergency cases in our OPD, and 80%, 70 to 80% of them either has irritation, redness, or some signs of conjunctivitis. So these are not COVID-19, but if you have a history of contact with a COVID-19 patient, or a history of travel to a COVID-19 red zone area, then you will consider this as a sign that you might have a COVID-19 infection. So that's it. Then what has been happening for the past 1 month for the eyes to most? See, we are all stuck in our houses. So what do we do in our houses? See, as Honorable Prime Minister Sri Narendra Modi ji appealed to us, mostly we have been restricting ourselves to our houses, going out minimal purchases and all in areas in which this is allowed. So we are mostly on either computers or screen, or mostly the mobile phones. So what happens when you spend quite a lot of time on these screens is that you will get something called a computer vision syndrome, which the basic symptom of it is a dry eye symptom. See, why does an eye get into trouble when it is constantly on the screen? See, the eye is not really meant for watching images on the screen. See, you have unlike reading a book. See, while you read a book, it has letters there, and you see the letters. But what happens on the screen is not an image as such. See, there are some flickers happening, and these get fused, or pixels there. They get, so eye has to fuse them to create an image. So it has to put in a bit of effort when it reads something on a Kindle or watches a movie. See, some people still are in the habit of reading books and newspapers and all, but mostly people read on Kindle or watch news on TV, or watch information that comes on your mobile phone, WhatsApp, search Google for information. There is an information explorer. You get to know everything about what COVID is causing even in the remotest part of the world. And probably you people know much more about COVID-19 than as doctors, because that's what's happening in the world. The problem with that, problem with you spending quite a lot of time on the screen, either on TV, computer, laptop, the phone, or Kindle, is that there's this huge lot of difference between reading a book and watching a screen. So what happens on a screen is that it's the image is not just a image that we see on a photograph. See, there are some flickers happening, and these flickers are fused into an image, and this is the image that you see. So for this flickers to be fused into an image, you need an effort from the eye. Okay, so when you sit on a computer screen or a mobile screen for a long time, the eye has to put in that much effort to see things on the screen. So this puts in a lot of strain on the eye. See, the eye that God has given us has not been made for watching screen and all. See, we have created technology for our benefit, and but if you don't take care, then that the eye can get into trouble. So there are two things happening. As I said, the eye strain is there to fuse the images, and if you are constantly on a computer, see, I am sitting on in front of a laptop screen. If I am in front of this laptop screen for 1 hour, 1.5 hours, definitely I'll have strain here. I'll have watering from my eyes. I'll have foreign body sensation. Why is there a watering and foreign body sensation? See, normally when you are outside and talking to people and normal living conditions, your eye blinks for about 15 to 20 minutes. See, for anything to happen smoothly, there has to be lubrication. For a wheel to rotate smoothly, there has to be grease in it. If the grease is not there, it creaks, creak. The fan is not lubricated properly, it makes a sound. So similarly, you have your eyelids moving up and down in front of your cornea and eyes. See, what is the function of this blinking? You have a fluid in the eye. You know that there is tears. This tears is something that lubricates the eye. It's like the grease for the wheels. So what does a blinking do? It resurfaces the surface of the cornea. So it smoothens tears, then it comes up. So if you don't keep on blinking, it is open for a minute, just try that. You will have a lot of discomfort in your eyes. So what happens is that when you don't blink, whatever tear film is there lubricating your eye, it just evaporates. See, if you want to dry your clothes, what do? You spread it and keep it for drying, right? So if it stays open, it causes dryness. Okay, so this causes foreign body sensation. Okay, so this is what causes discomfort for your eyes. So what happens is that when you are keeping on watching a screen, your blink rate comes down. I said the blink rate normally is about 15 to 20 times per minute. So it comes down to maybe 4 or 5 per minute. So what happens? The eye stays open for more time. So there is more of evaporation happening, and this causes huge lot of dryness. This causes a huge lot of discomfort for your eyes. So what does the eye do? It tries to cause more lubrication by producing more tears. Okay, so this is a problem that can happen. And as I said, as you try to focus quite a lot, then it causes eye strain. So this is it. So how can you prevent this? So one is consciously trying to blink while you're on computer or screen. Okay, so you try to blink, but see, it's easy for us to advise patients or anybody to keep blinking while watching something. You're watching the latest movie on the screen. Would you be interested in watching what is going on the screen, or thinking about blinking? It doesn't happen that way. So what is the way out? If you are sure that you are going to be there more than 2 hours constantly on a screen, it's better to use lubricating drops. So there are a lot of lubricating drops available over the counter, like teardrops or teardrop gel, or a lot of other lubricating drops are there, which your doctor will prescribe, or you can get it off the counter. You can use it while you're working, and or on the screen you can put it. The drops these days, they come without preservatives, so it's safe to use them how many times you want. But generally, what we advise is 4 to 6 times in a day you put it, and that takes care of your lubrication of the eye. So that's one. And I would advise anyone who is on working on computers, or on leisure on computers, or especially the mobile phone. This is even more dangerous than the bigger screen of a laptop or your TV. So when you are on the screen, if possible, don't take a break after 20 or 30 minutes. So how do you take a break? Just look somewhere far off, or just close your eyes for 30 seconds. You're not going to miss anything. So that gives the eye enough time to get back to its original self. So that is one way that you can reduce the strain. But I would advise you not to be on a screen for more than 1.5 hours as a stretch. And if you ask me how many hours I can be on computers or on a screen during the whole day. I would say about 6 hours. So you see, there are software professionals who are there for more than this time. Many of them have eye strain, but they take care. They take breaks in between. They use the lubricating drops, as I said before. So they know the lighting is quite proper. So they take care. Now, see, during this COVID time, see, we're not really sure when all the regular activities are going to happen. But it's all this extra time on computers is new to you, so you have to take care. Use lubricating drops. Restrict your screen time at a stretch, maximum 1.5 hours in a whole day. 6 hours, ideally restrict to 6 hours, a maximum of 8 hours. So, and drink a lot of water. Take proper nutrition. Do some exercises. You feel that there's nothing much to do. Previously, you used to have a fixed time for exercises. Now the whole day is there, so you'll think, okay, we can take exercises at another time, and the day passes and you're not exercising. So consciously make sure that you exercise for half an hour to 1 hour in a day. Drink a lot of water. Take your food at the right time. When you are on screen, the habit is to be a couch potato. You sit there and keep eating. Don't do that. Eat on your dining table only. So, and you have your fixed time, breakfast, lunch, dinner, and have a dinner early. Go to bed early. Make sure that you get about 8 hours sleep in a day. So this is basically about taking care of your eyes during this time. And if you can't actually see some areas, I'm sure that they're not going to take off the restrictions of travel for some more time. And if you're a glaucoma patient and you don't know what to do with your glaucoma medications, that is one set of patients that we see who are on chronic medications. See, you have general patients, diabetics, hypertensive, and all those with cardiac diseases who are on long-term medications. Among eye patients, all these glaucoma patients are the ones who are on long-term medications. They have to continue the medications for life. So some people, they might say, okay, I can't meet my doctor now, so I'll do one thing. I'll stop the medication, then meet the doctor, and then decide. No. So continue the medications as per your doctor's original advice. So use your medications. One problem that, say, I get calls from patients. See, I've been using this X medication. It is not available in the pharmacy near my area. So what to do? So the different companies come out with the same medications. See, even if you substitute it for the time being, you can ask your pharmacist and tell them that your doctor has given you advice that for the time being it can be substituted. So use the medication. Make sure that if you're on 3 medications, make sure that all the 3 medications are put. You're on 2 medications, make sure that all the 2 medications, both the medications are put. So make sure that you are on medications properly. And another problem, as I said, is allergic conjunctivitis. Allergic conjunctivitis, what we basically ask the patients is to tell them to avoid whatever is causing this allergy. It could be dust on top of your fan, or it could be because you are doing more of gardening because you're not going out. So there might be pollens. So avoid them. If there are pets in your house, make sure that they're out because the mites from the pets can cause this allergy. And if you can clean your eyes with cool water, boil the water, cool it, and you can clean them. So it takes care. It takes away a bit of this allergens. And what the basic treatment, most effective treatment for this allergic conjunctivitis is some mild steroids, loteprednol or fluorometholone, but never never put these medications on your own. You should not go and ask, even if a pharmacist gives you this steroid drop, don't use them, because long-term use of steroids in some patients can cause glaucoma and loss of vision. I've seen quite a few children who have been on long-term because they were on self-medications with steroids and had advanced glaucoma in their eyes. So allergic conjunctivitis, for the time being, if you can meet your doctor, he'll give you the medications. Otherwise, you can use these lubricating drops. It gives some amount of comfort, but avoid these allergens. So I was actually responding to Nilesh to his query as to whether reading books on Kindle is as good as on iPad or tablets. See, it's anything is a screen. They're not as good as reading books. So be it Kindle or iPad, iPhone, your smartphone, your TV, and all, that causes a lot of strain. So you have to be disciplined when you're using them. Don't use them continuously for more than 20 minutes. If it is for a maximum of 30 minutes as a stretch, then take a break. Consciously take a break. Close your eyes and take a break for half a minute or 1 minute. See, we tell people, yeah, keep blinking. It's not easy to keep blinking, but it would be better to use lubricating drops like tear drops or teardrop gel and all. See, these are drops that give cooling to your eyes. What happens is you're watching a screen. Your tendency to blink comes down. So normally 15 to 18 or even 20 times a minute you blink. So that helps resurfacing of your tear film. That gives comfort to your eyes. When you are on a screen, you keep staring at the screen, the blink rate might come down to 4 to 5. So that's not a nice condition, and even consciously blinking is not also that very easy. So you can use a tear drops or other lubricating drops to give comfort to your eyes. That is one thing, and keep it at a proper distance. This is I'm on my laptop now. It's at an arm's length distance. So it should be at a 20-degree angle down from your eye level. So I'm sitting now in a proper position. So that's it. And there's a query from Rajiv Singh. Yesterday, my uncle suddenly got redness in left eye. What is the cause? OPD is not running due to coronavirus. Rajiv, I hope you were listening to my previous parts of the broadcast. Many of the patients who see in our we see in our OPD are those with red eye, and majority of them are with allergic conjunctivitis. Some are with infective conjunctivitis. For you to really understand which one it is, I can give you some tips, but it would be better if you can find a hospital which is open for emergencies. But generally, the infective red eye will be having discharge, and there'll be severe redness and all. Allergic conjunctivitis is basically itching, more of itching, and not much of discharge would be there. So basically, it is it. And red eye, if you can, see, this is one of the conditions in which I would love to see the patients, but if you can't really go to this is basically how you compare these two. And what are the precautions for kids to avoid eye strain when using laptops and mobile phones? I mean, kids and you, I mean, kids might be able to manage it much better than you, Omar, but still, whoever, but it's difficult to monitor them. It's difficult to discipline them, especially when they don't have anything much to do these days. But you're there at home now, so you can monitor them. Make sure that they are not continuously on mobile or laptop. I would prefer some screen much bigger than the mobiles, because you can actually monitor what they're seeing, how much time they're seeing. Because with the mobile they can go anywhere and be on hours on the phone. So make sure that they are off the screen for quite a bit of time. So normally, no more than an hour I would suggest for kids, but at this time it is difficult to restrict to 1 or 2 hours. So maximum 4 to 5 hours you restrict the screen time for your kids. Uh, then I'm feeling pain around eye, headache sometimes in the evening, and spending 8 to 9 hours on digital device. The matter factors. Um, okay. Uh, see, um, it's just a same thing. Like see, the most difficult situation that we face these days is that you are spending quite a lot of time on the screen. So you have to have a proper discipline while you're on screen, and restrict your uh, screen time to a maximum of 5 hours in a day, not more than half an hour at a stretch. If somehow you are on screen for more than 2 hours, definitely take half an hour or 1 hour break in between. So generally, does it probably have covered most of what I wanted to cover. Uh, See, take care of your eyes. Just because you are quite bored these days, don't spend all your time on the screen, and take it very seriously. Social distancing, washing hands, not touching your face uh, uh, after going anywhere or touching anywhere. So these things you have to really take care. And all red eyes, though patients with COVID-19 can have red eye, all red eyes these days are not because of COVID-19. It is patients who have associated fever, uh, cough, uh, shortness of breath. If those patients have redness, definitely you have to suspect COVID-19 in these cases. Minimize your visit to eye hospitals. Only in case of dire emergency, visit eye hospitals. Uh, what I consider dire emergencies, ocular emergencies, at this stage includes sudden decrease in vision in one or both eyes, foreign body fall into your eyes, injury to eyes, redness of eyes, especially in recently operated eyes, severe eye pain. So if you have any of these, definitely visit your eye doctor. Definitely one or two eye doctors would be open in your locality, and the police would definitely if it is a condition like this, you have to just fill up the form and tell that you have this eye condition. I have to visit my eye doctor. They'll definitely let you visit your eye doctor, take a proper treatment. You have any other eye symptoms, eye strain, watering, simply like recently you found that you can't see near, those cases you wait, because there's one more issue now. Like you feel that there won't be much rush in the IOPD these days. Okay, then it'll be easy to get an eye checkup now. No, there are two problems now. you can get a COVID-19 infection on the way or in the hospital or anywhere. So that is one. And if the doctor has actually prescribed you glasses, because everything is shut down. See, the optical might be up and running, but they might not get a proper supply of the correct glasses that you require. So there might be compromise on the glasses that you are being given. So for all these not so emergency conditions, please don't visit your eye hospital. Definitely, if you have one of these conditions that I mentioned, definitely go there. Make sure that you do. I'm keeping on telling this because that's extremely important. This is the social distancing and all is what has helped Kerala, Singapore, and all to come out and flatten the curve of the infection spread. As I said, Kerala has flattened it. It's about only 3 cases yesterday. So we are actually proud of it. But we have to be really careful, thinking that we have taken care of everything and going back to normal activities is asking for trouble. We have to see, our Prime Minister has extended the lockdown till next month 3rd. Follow the instructions and we'll stay safe. As I said, your eye doctor and your ENT surgeon comes really close to your face while examining you. So there is a high risk that you can give COVID-19 infection to them and they can give a COVID-19 infection to you. So go to a hospital only if it is a dire emergency. Then I spreading through tears. That was one big query that I could see in the on the chat box. So it can't actually spread through tears, but it can. See something you touch somewhere and touch your eyes, then you can get the infection. So you can get it through your eyes. But somebody, from the studies as of now, it can't spread through tears, though it was as I said, it was an ophthalmologist who actually, we have to pay homage to Dr. Li Wenliang from Wuhan, China, who brought this deadly, highly infective virus infection to the notice of the whole world population. So basically, this is it, and there are some patients who are on chronic medications, especially glaucoma patients, for checking your eye pressure. Checking your eye pressure routinely is extremely important, but at this time you have been given particular medications depending on your eye situation at that time. Your doctor would have prescribed these medications based on your condition at that time, and he might have given you 1 or 2 or even 3 drops. Whatever drops were given at that time, all the drops and at the frequency that was prescribed by your eye surgeon at that time, you continue them. The one difficulty that people are facing is that all the brands that has been prescribed might not be available in the locality that they are living. You can, for the time being, you can substitute it by other brands, no problem. But make sure that the drops are continued. Don't stop glaucoma patients, especially. Don't stop medications because a particular brand is not available. No. And whichever brand is available, you buy that and put it according to the initial advice. You have anything falls into your eye, don't try to take it off by yourself. Don't rub your eyes, that can cause infection. Definitely consult your eye doctor. That's basically what is there for eye part of managing your whole condition is difficult times. It is difficult. You have a lot of time. As I said, mm, uh, you you put a control on yourself. Sleep minimum 8 hours. Do some exercises. I know that in many areas you're not allowed to walk on the road, but whatever available space you walk, take a proper diet. Sitting at home, sitting in front of TV, keeping on binge eating, that's not good for you. Reduce your screen time. Put lubricating drops frequently. Put lubricating drops like teardrops or whatever, so that your eye stay cool. Mm, that's basically it. I think. Let me check if there are some more queries on the chat box. It's basically this: take care of your eyes, take care of yourself, take care of your family members, take care of others in the community. Any query, like we have our Only Ophthalmological Society website, we have our state associations. All of us are Only Ophthalmic Society on the state association. We have Kerala Society of Ophthalmic Surgeons in Kerala, the Karnataka Ophthalmic Society is there, Tamil Nadu Ophthalmic Association, Delhi Ophthalmic Association. See, all of us are trying to take care of your eye needs. We will be willing to do any sacrifices to take care of you. But those patients who were posted for surgery before this lockdown came into effect, don't expect the surgeries to happen immediately after the lockdown is lifted. It might take 5 days to, at least about 3 to 5 days for us to get the entire system running back again. We'll be sending the cultures to make sure that there is no infective foci anywhere. Though we are maintaining the OT and running the whole system just the way that we do on routine days pre-lockdown, but we are there to take care of you. There'll definitely be one or two eye hospitals open in each locality. Please contact them. If you have any queries, you can call up your doctors. You can send a photograph of your eye condition and send it by WhatsApp and all. Definitely, we are all there to help you. Stay safe. Stay at home. Thank you. You can clean your eyes with boiled cool water. So these are the basic problems that you can face when you are on a lockdown and during this period when COVID-19 is in air. Take care of our eyes. As I said, reduce your screen time. Use lubricating drops. Clean your eyes. Avoid dust and allergens. Restrict your screen time at a stretch to maximum 1 to 1.5 hours in a day to 6 to 8 hours. Sleep properly, very important. 6 to 8 hours of sleep in a day. Drink a lot of water. Take your food on time. Take care. I hope you get through this COVID-19 period with full health. Take care of your eyes. Take care of yourself. Take care of your family. Thank you.